Thank you, Stephen and Veronica. And yeah, it's really great to be here today, to have so many people signed up. I think it's always really fantastic that so many people are interested in involving children and young people in research. I just wanted to say as well that we've made sure to allow some time at the end for questions and discussion. And I know it's a little bit difficult in this kind of format, but we'll try and do it as much as we can, but really to use this as the start of a conversation, because I think it's always, those of us who do work in this area, it's always really nice to kind of get together and learn from each other. So this is definitely not about me having all the answers. It's more me starting a conversation and sharing some of my experience with you all, and hopefully you'll be able to share some of yours as well. So I'll just share my screen. So hang on, so Stephen, let me know if this looks okay to you. Yep.
Yeah, that's perfect from my side.
Okay, lovely, thank you. So yeah, as Stephen said, I joined the University of Hertfordshire last September. So I'm a senior research fellow, and I do a lot of work around children and young people's involvement in health research and health services. And I'm particularly interested in qualitative and participative methods, including co-production. And my background before I joined the university was in applied social research in academia and the voluntary and public sector. And I've also done a lot of work as a freelance consultant and advisor working on research and public involvement. So one of the projects I'm going to talk to you about is from my last role, where I was a senior research fellow at UCL, University College London. And there I worked with the Moorfields Biomedical Research Centre, which is a children's eye hospital, supporting young people's involvement in their paediatric research. Before that, I've worked at the Centre for Public Engagement at Kingston and St George's University. And prior to doing my PhD, worked in the voluntary and public sector, including helping to set up the Generation R network of young people's advisory groups, which I'll talk about a bit more shortly. And also doing work with disabled children and young people at the Disability Rights Commission, which is now part of the Equality and Human Rights Commission. I also, for about 10 years, was a member of the National Institute of Health Research Evolve Advisory Group and various children and young people's working groups that they had. So essentially, I've spent a very long time reminding people that public involvement needs to involve children and young people as well as adults. And that's and working with and promoting the involvement of children and young people has been something that I've been interested in throughout my career, really. And I think, going back to what I said earlier about sharing practice, I think probably the thing I've learned most is to kind of feel comfortable with being flexible and making it up as I go along, because I think one of the most important lessons, and I'll come on to this at the end, is that involving children and young people involves being able to be responsive and kind of in the moment. So what I'm going to talk about today is two things. Firstly, why involve children and young people? And obviously you're all here because it's something that you're interested in. But I know for those of us working in the field, quite often we have to work quite hard to convince colleagues, funders, other people that there's value in this. So it's kind of, giving you the arguments for why it's a good thing to do, kind of key considerations for how to do it well. And then I'm going to move on to some of the more practical examples from some of the work that I've done. And as I said, it would be really great to hear a bit more about some of the work that you've been doing and some of the challenges you faced as well. I think one of the things we don't talk about maybe enough is what doesn't work and how we can change that. So sharing the failures as well as the successes. So thinking about why involving children and young people, I think one of the first things to do is to unpick what we mean by children and young people. So legislatively, in relation to most children's services, children are generally understood to be those from birth to 18, but it varies. So, for example, quite often children and young people with special educational needs or disability or looked after children might get support up to the age of 25. And in some, say, European contexts, quite often young people can be 15 to 25, sometimes even older. So I think that's really important to consider that, and also the fact that we talk about children and young people, but that's far from a homogenous group. And obviously the difference between a 2-year-old and a 17-year-old is huge, but also it's really important to think about inclusion and diversity and who does and doesn't get involved. But it's also important to think about how we understand children and childhood. And traditionally, particularly in healthcare, children are often seen as more vulnerable, less competent. They're becomings rather than beings. And this idea, these paternalistic ideas of children as needy, as incompetent, as vulnerable. And this is evident in the view that children need to be protected and provided for in order to develop well and enter the public domain of adulthood. And quite often in this kind of, so in traditional research with this sort of viewpoint, adults are often proxies for children and young people. People talk to parents and carers instead of children and young people. And I would argue that very much we need to be thinking about involving them as well as, because obviously the views of parents and carers, particularly in health and social care, is also important. And if this is something that you're interested in, I think the field of childhood studies speaks a lot to this, the ideas of children and young people as social actors and childhood as a social space in which they have agency and are experts in their own lives, and that they should be involved in research and in other things while they are children and young people. And I'll come back a bit to this tension I alluded to between participation and protection rights later on. But I think in terms of, there's two key arguments for involving children and young people. The first is impact, that it improves research, it makes research and resulting services and policies better. It's an area where there's increasing interest and also increasing recognition that it's not the same as involving adults. As I mentioned, I think in National Institute of Health Research and other things, I think those of us who work in this area have spent many years trying to point out to people that this is different. Obviously, key principles around involvement are the same, but with involving children and young people, there's things about accessibility, inclusion, I think how to make research engaging for young people, also things like availability. So, making sure that you arrange involvement around, school holidays, to, school hours. Thinking about the role that parents, carers, and other adult professionals may play as gatekeepers. Also, things like safeguarding concerns, I think, are also different for children and young people than adults. But I think it's really important to do this. If you don't involve children and young people and you only involve adults who speak for them, you're not going to get their views, and ultimately I think that getting their views really improves both research and the services and policy that result. But obviously there also needs to be benefits for children and young people of being involved as well. There needs to be something in it for them to want to get involved and stay involved. And the picture on this slide is guidelines that were developed by a group of young people I worked with when I worked at the National Children's Bureau. And this was guidance that they came up with on what they thought adult researchers needed to know about working with young people based on their experience. I think this was a couple of years into the group. And there's a link to this at the end of the presentation. And just to say as well that you'll get a copy of, as well as the recording, you'll get a copy of the slides from today as well. And this is a quote from Dame Sally Davis, who was the last Chief Medical Officer. And in her annual report about 10 years ago, she wrote with a particular focus on the need for children and young people to be involved in the same way as adults in health research and the development and delivery of health services and policy at both national and local levels. And I think it's that kind of having that high level endorsement of young people's involvement is really, really important too, again, as a lever for making the case for why this needs to happen. And obviously involving children and young people in research grounds it in their lived experience, and as I said, makes sure that it better reflects what matters to them. It's also a really good way of making sure you're asking the right questions in the right way. And I'll talk a little bit later on about involving children and young people in priority setting, because that's a really important way of getting them involved in deciding what research should happen and when. But I think there's a really important point, which I'll come back to, about making sure that children and young people are involved throughout the research process if possible, rather than just what quite often happens is that people will involve, say, a young people's advisory group at the start when they're developing their funding application or when they're developing their data collection tools for ethics submission, and then we'll kind of tick the box to say they've done their involvement and go off and do their research. But I think with the shift to the increasing interest in co-production, there's kind of more of an idea of involving young people on an ongoing basis and them having more involvement in shared decisions about the research. But there's growing evidence that it improves research, it makes research better. Involving young people in writing up research, make sure that it's more relevant, more accessible. Involving them in disseminating research findings can be hugely impactful. And I mean, I've certainly done that before, and I've co-presented at conferences with children and young people, or involved them in producing lay summaries of research. And quite often a lay summary that's been co-produced and co-designed with young people is far more fun for most adults to read as well. So I think it's really important to think about that, like, right from embedding it throughout the process. So that's the impact argument. I mean, the other key argument is around children's rights. And this centres on the UN Convention on the Rights of the Child, which, as I'm sure you know, is established international recognition that all children have rights to both higher standards of healthcare and to have a say in decisions that affect them. And the UN Committee on the Rights of the Child they periodically issue general comments around what the rights mean, because if you look at the rights, you can see that they're not things that many people would disagree with. But actually, I think what the general comments do is kind of unpick in a bit more detail what signatories to the convention are actually expected to do, and all signatories to the convention get assessed on a periodic basis to see whether they're actually meeting their obligations. And this is in relation to general comment on Article 24 about the right to health, and they explicitly link it here to Article 12 and how children and young people need to have a say in all aspects of health provision. So both at the level of being a service user, but also in terms of involving them more in the design, the delivery, the evaluation of services. So I think that's really important as well, that there's a thing about, yes, it makes research better and there are benefits for children and young people to get involved, but also they have a right to be involved. But it's there are tensions, and I mentioned there are tensions between children's participation, provision and protection rights. And I think particularly in healthcare, that can be an issue, because the idea that children need to be protected, decisions need to be made in their best interests. And there's quite often a perception that that's more important than their participation rights. But I would argue that actually that it's not a dichotomy. I think promoting participation rights and protection rights don't need to be in tension. That actually, if children and young people have a say, you're more likely to be able to protect them and address safeguarding concerns. I think another difference between children and young people's involvement and adult involvement is that there's quite often a tension anywhere, power dimension between professionals and service users, people with lived experience. And with children and young people, you have the added dimension of the adult-child dynamic. And also, I think children and young people's input isn't consistently sought or acknowledged or embedded within research or services in the way that it is for adults. Though, of course, obviously that's far from ideal in some cases as well. So there's pockets of really amazing and innovative practice, but there's an awful lot of studies where it doesn't happen, or it doesn't happen as well as it should. There's also, while there's a growing evidence base, there's definitely less evidence on the experiences and impact of involving children and young people rather than adults. And one of the things, I think is really, really important is, if you're doing work to involve children and young people, do share it up, do disseminate it, do develop peer-reviewed publications, ideally co-authored with young people, because the more we do that, the more we have evidence base about, with reflective practice about involvement, the better it will be. There's also, there's a paper at the end that I'll reference that Jenny Preston and I wrote about which children and young people were involved. We did a piece of research for the James Lind Initiative, and we found that there's really limited evidence on which children and young people are involved. So it's really hard to know, but as much as we do know, it's not as diverse or inclusive as perhaps it could be. Another issue is that the dominant model, and including some of the work that I've done, is around these young people's research advisory groups, or YPAGs, which work really well quite often and work really well for institutions and for research projects, but they don't necessarily work for all children and young people or all projects. And one of the examples I'm going to go on and talk about is about a project where we started off trying to set up a YPAG, a young people's group, and ended up with a completely different model. And I think this links into wider debates about diversity and inclusion in public involvement, which I know the National Institute of Health Research in the UK and others have been looking at. And it also links into debates about the voices of young people who are deemed to be vulnerable or are less frequently heard. And the last sort of thing to sort of think about as well is about ethics. And I know the one thing that keeps coming up, and I think came up on Twitter recently, is around whether you need ethical approval to do public involvement with young people. And the general guidance is that you don't, because you don't need ethics approval for public involvement. But there is, nonetheless, I think that's not always the case. There are some complications around, say, if you're going to publish or evaluate public involvement, some journals and others will want to have ethical approval. But also it kind of, there's this idea about, you do your ethics and then you get on with your research, but actually whether or not it needs formal ethical approval from a research ethics committee, you absolutely need to think about doing involvement ethically. And that's an ongoing thing all the way through the process. So I think that's something to kind of bear in mind as well. And again, I think there's a few references to that later on. But I just wanted to move on now and think about how to involve children and young people. And this is kind of coming up with some of the examples from my own work. So there's various ways in which children and young people can be involved. You could involve going to one-off discussion groups or consultation meetings about particular elements of the research. You could have a young people's research advisory group, as I mentioned, a YPAG, which might meet face-to-face or online or in other ways. And that can be a YPAG that's been set up within your organisation, within your project that you're working on, or it can be an external advisory group. So I'll talk a little bit about some of those advisory groups in a minute. But that can be, going to an pre-existing young people's advisory group can be a really good way to get input into a research project early on, and also to get input into your public involvement plans. Young advisors can also work alongside the research team or as members of an advisory group with adults. And also, obviously, there's been increasing interest in co-production. And I think, working with young people as co-researchers to work on a research project. I'll talk a little bit more about priority setting partnerships later on, but I think that's a really important way as well to get input from a wide range of young people into what research needs to be commissioned. So these areas in bold are the ones I'm going to focus on in the talk I'm going to do today. There's a whole other literature around young people-led research, peer research, which I can certainly signpost people to, but we don't have time to cover today. But I think that's another area of interest. And I know the young people's group I mentioned at NCB, who developed those guidelines for researchers, what we did with that project, that was a Wellcome Trust funded project where most of the work was the group meeting and feeding back on work that researchers do. But we also had some money for them to do their own work. And rather than do a research project themselves, because they were all really busy with exams and things, they actually chose to commission some researchers to do a project for them. And that was a really interesting way to kind of flip the power dynamic on their head, because they came up with a specification, they decided who to award the contract to, and the researchers came to the young people's meetings and reported back to them or got their input at key stages in the research. So I think doing things like that can be really interesting. But yeah, I think it's just worth thinking about that, whether that could be part of a research project or whether you can look for funding to support young people to do research on things that matter to them. But as I said, today I'm going to be focusing on getting young people's input into adult-led or co-produced research projects. And so the first example, this is the IYPAG, is a young people's advisory group that I facilitated in my last role at University College London. And there were 14 young people who were aged between 10 to 18. And because it was focused on eye and vision research, they all had experience of eye problems and eye treatment, or they were siblings of children with eye or vision conditions, or they'd taken part in clinical research in eye studies. And we met on Saturdays 5 or 6 times a year. The group's still running. And obviously, since spring 2020, the group moved on. So we had 1 year of in-person meetings before COVID and then moved online. And what we tried to do with this group, which is different to other young people's groups I've run in the past, is we tried to run it on co-production principles. And that was really interesting because obviously when we started, a lot of the group were kind of 8 or 9. So it was quite, we couldn't just start off and say, hey, let's co-produce this piece of research because, this project rather, because they didn't know what research was, they didn't know what involvement was, they had no previous experience to know what we were co-producing. So a lot of it was, we worked towards co-production. We started off by, making decisions about how and where we met. And as we kind of built on that as we went along, kind of regularly reviewed what we did. And there's some references later at the end. But one of the things we did last year was we got funding to co-produce an evaluation of the group. And so I worked on that with 5 members of the group, so the young co-evaluators. And together we designed the research tools, they facilitated focus groups, and we collaborated on data analysis and the production of a report. And that was really interesting. And I think working with them on that was I think it was really great for them in terms of them actually having hands-on experience of doing an evaluation project. But also the insights that we got, I think, were very different because it was a project where we were co-producing the evaluation together. And so the focus of the evaluation was about finding out what difference the IYPAG made to research and to the group members. And I think it was really interesting when we did the focus groups and things, how different the responses we got from people because the young people were asking them. And these were the aims that they came up with about what difference it makes, what works well, what could be improved, and how can we plan for the future of the group. And future planning is another thing that's really interesting because actually I think with this group, when I left and went on to my current role, I think there's been a bit of a hiatus, which I think they've, recovering from now, but actually trying to find somebody to carry on running the group and kind of the work that's actually involved in getting a group like this up and running and keeping it going is quite often underestimated or reliant on one person within an organization. So I think that can be something to be aware of as well, about thinking about how involvement is resourced and where the expertise lies. And so we collected data for the evaluation in a variety of ways. So we co-designed surveys. But again, a lot of this came from, in terms of the methodology, came from young people. So with parents, they were very clear that we shouldn't do focus groups with parents. We should do a survey because all their parents were really busy and didn't have time to take part in a focus group. So they were very clear that they wanted that to be a survey instead. With the focus group with researchers, they asked me to facilitate that because they said if we ask them the questions, they're going to be worried about saying things we won't like to hear. So they came up with the questions and asked me to lead that discussion. And then they run a really interesting focus group with me and the co-facilitators, which they'd planned on their own. So we did all this, obviously because it was during COVID, we did all this online. So they went into breakout groups when we were in our evaluation meetings and developed the questions and then facilitated the focus group. So, and just a few kind of pointers around some of the creative methods that we used. So one of the things we did in a face-to-face meeting was I'd use this kind of river of experience idea before. So along the top, we have kind of key points of the things we'd done, conferences we'd spoken at when people had joined, when the group had started, and along the bottom were meetings and reminders of what we'd done. And the young people came up with the idea of turning this into a puzzle. So we started off the focus group by getting the young people, the participants, to put the puzzle together and use that as a kind of a springboard for starting a discussion about what we'd done in the group. And it was as a visual reminder as well. And the bottom right-hand picture is while that was happening with some of the group, the other group were taking it in turns to do peer interviews with each other about being members of the group. And again, the young people came up with the idea of making this like a film. So they made these props, and one of them was the interviewer and one of them was the interviewee. And this was an exercise we did for the analysis. So again, because this was, I think when I've done this in person, I've used things like quality streaks or buttons to kind of introduce the idea of organizing and sorting things into groups. So introducing thematic analysis. And so to do this, to try and replicate this online, we gave them a Jamboard with lots of different images on it and got them to think about how you could organize images. So you see they had kind of like big overarching themes around man-made and living things, and then animals or food, and then also made a link between chicken as a food and chicken as an animal. And it was quite an interesting way to kind of get them to think about and organize this. And then we looked at some of the data that we'd collected. This is an example from analyzing the data from one of the focus groups, where so the themes are in yellow. You don't need to be able to read this, it's fine. And then we took extracts from the data and they're in the blue post-its. So it was a way to do some collaborative thematic analysis. And then I think in that case, the young people didn't want to go through line by line every single transcript. So I went away and did that. And then we kind of discussed the findings and kind of did it as an iterative process together. And the key findings in terms of going back to what we were talking about earlier around impact of involvement is they were really, one of their big motivations for joining was wanting to meet other young people with similar interests or experiences, and also to learn, to develop new skills. So this is what I was talking about earlier about what are the benefits for young people. But also one of the really key motivations for them was impact on research, so making a difference. And the adults talked about that too. But I think the children were like, it would be great to come along and have a nice time. But actually what they wanted to know most of all was even how their input was making a difference. And so it's really, really important to think about how to capture that, and also to make sure that how that's fed back to young people. So one of the things I always do is if researchers are going to come on work with a group that I'm facilitating, an obligation related to that is that they have to feed back to the young people on the impact that involvement has made. What difference did working with the group make to your research? They really valued the co-production approach and the fact that we combined sessions where a researcher would come along and talk to them with sessions where we did more creative things. And many researchers came to the group in the planning stages, as I mentioned, so when they were developing funding bids or submitting something for ethics. But we had quite a few projects where they came up, a few times through the research, and that was really, really helpful, and that was valued most by the young people and by the researchers. But also, I think it was planning and facilitation was really, really important. And I think the young people picked up on that as well, that the sessions they thought weren't as good were the ones where the researchers had said, oh, I don't need to prepare, I don't need to do anything, I'll just come and show them loads of slides and have a chat. And quite often those sessions would fall flat, where the ones where people would work with me to kind of plan something that was engaging and interactive was really helpful. So the picture on the top right is, I think, somebody was talking to them about research that they were doing on eye patch, uses of eye patch. And again, this is when we were meeting on Zoom, but we used a Zoom whiteboard for them to develop, their own fun versions of eye patches, to think of what an eye patch would look like, and use that to then start the discussion. And they found that, and I think this has happened with the other group that I'm working with at the moment, that actually there are advantages to meeting online as well as in person. And actually I think it's important to think now as we move to kind of living with COVID, to think about kind of how we can combine the two. And at the end, I put a reference to a blog post that I wrote with some of the young people after an event we spoke at about doing co-production online. So I think it's worth thinking about that as well. How will things be different once we can regularly meet in person again? But the link to the full report is at the end of this presentation, and I'm also in the process of co-authoring an article about this evaluation with some of the young people as well. So a couple of other projects I just wanted to mention fairly briefly. So this was as part of my doctoral research. I did an action research project where I worked collaboratively with health professionals, participation staff, and young people. And this is in a community children's health partnership in Bristol. And they'd involved children and young people throughout the design and delivery of this service. So it had been commissioned by a charity, Bernardo's, and a National Health Service Trust. And they'd involved young people in, right from the start, in the bid, in developing the services, in staff recruitment. But it worked better in some services than others. So what they wanted to do was standardise and embed participation throughout service delivery. So we spent about 18 months working together, co-producing this participation strategy. The tricky thing is that actually towards the end of the project, the service came up for recommissioning and actually changed significantly. So it was taken over by a consortium of 3 private sector organisations who substantially cut the participation budget. And what had been intended as this is great practice and how can we make it better, became in some ways more of a historical document about a great service that has had to change and downscale quite considerably. But I think the fact that we were able to do this action research project and write the book chapter and other things related to that has been really helpful. And the chapter's in a book that I edited around children and young people's involvement in healthcare. And I think what was really great about doing this and the book was that pretty much, I think, all the chapters were co-authored by young people too. But I think it was a really interesting process. And I think finding ways to engage young people and health professionals to work together, I think we found when we sat around and talked, it tended to be the adults who dominated. But when we did things like, in the picture, we did things like, making T-shirts or storyboards or things like that, the young people generally more likely to get stuck in there than the adults. So we use lots of ways to try and work together, as well as doing some stuff separately with professionals and children. And the mission statement that they came up with is here. This is at the end in the participation strategy. And the other one that I mentioned earlier, this was a drug and alcohol intervention, a research study on a drug and alcohol intervention, which was adapting something that had been developed for adults, for young people. And because of the focus, we wanted to involve young people who had lived experience of using drug and alcohol services. And what we found was that our original plan of setting up a young people's advisory group just didn't work, because these were young people who had really complex lives, a lot of ongoing, complicated family circumstances, adverse childhood experiences. So we had young people's group meetings, and sometimes some people would come to them, different people would come every time. Some people came consistently, some didn't. But we also went out to services and engaged young people that way. We had, I think, the 2 young people involved in the project the longest. One of them never actually was able to come to any meetings because of health and geographical reasons. And all of the work we did with that young person was either one-to-one, so meeting in coffee shops or McDonald's, or over the phone or online. So I think it's and what we ended up with which I'll talk about in a minute, is a model for involvement which is a bit more flexible and young people centered. And the reference, which goes into more detail on this, is at the end. But I just wanted to share some quotes here from some of the people involved in that project. And I think one of the things that was really interesting was the young people saying that actually a lot of them were saying things like, I wanted to get involved in this project because I wanted to stop another young person going through what I went through. And that, actually using difficult experiences was like really powerful for them. And I think that speaks to the point I made earlier about participation and protection rights, that actually sometimes in seeking to protect young people who are deemed to be particularly vulnerable, we might be denying them the right to have a voice. And so the model we came up with was a hub and spoke model. So essentially it was about having this core young people's advisory group, which people could move in and out of, but also going out to young people where they are, engaging young people in ways that worked for them. And the Royal College of Paediatrics and Child Health have, in the UK, taken a very similar approach, I think, to a lot of the work that they do, that they have some core young people who get involved in a lot of their work, but they also go out to young people in relation to specific things. And that's something to think about as well. Even if you do have a young people's group, can you also develop a network with links into community groups or groups of young people with specific lived experience? in working involving young people who are less often heard in this project, services were the absolute key. I think, finding people in services who knew young people and had relationships of trust with them was really, really key for getting young people engaged. That was the only way we got young people to be involved in the project, was by finding project workers who got it and were willing to support them. Involving young people in recruiting others and in planning projects, I think we found was really important. And I think if we'd involved young people in planning this project right from the start, we probably would have realised that the young people's advisory group model wasn't going to work a lot sooner. So I think, and the other thing I think, as I mentioned earlier, I think it's really important to involve children and young people throughout the project, but it's also really important that they don't have to be involved at all stages. Not everyone can be involved in everything, and there might be young people might need to move in and out of the project. And I think it's really important to provide the opportunities, but also the flexibility, and offer different levels of involvement at different stages. It's also really important to make sure that you have involvement leads or input from people with relevant expertise, and that any work that you do is also linked into wider debates about inclusion in public involvement, because a lot of that applies to adults as well as children and young people. And I mentioned earlier, one of the other examples was around one-off workshops. And this is a picture from a workshop that I co-facilitated at UCL, University College London, to inform a systematic review they were doing on services for young people affected by adverse childhood experiences. And again, this is like a group of young people who would be deemed to be particularly vulnerable. And there were definitely challenges with this workshop. And again, we worked with an organisation who supported them. And I think having that trusted gatekeeper was really important. But the reference there is for a blog that we wrote about some of the learning from that process. And more recently, I did a similar thing again with University College London, where, but this time online during COVID, where we were looking at the role that young people play in responding to and contributing to online content related to eating disorders. So OEDC stands for online eating disorder content. And again, you'll see that one of the things in terms of tools that we did for both groups is starting off with flip charts and post-its as a way to, so in this case, it's like, what kind of problems might young people affected by adverse childhood experiences have, who might be affected and how. And in this case, again, we asked some series of questions, and what I found with things like that, particularly on sensitive topics and with young people with lived experience, is doing things like this to start with can be a really good way to kind of start the conversation going, because it's anonymous. If you do it on, in this case, we use Google Jamboard, you can't see who's posted what. And then we could use that as a focus to kind of get the discussion started. So just kind of a couple more slides, then we'll open this up to questions. So at the moment, we've just started, restarted rather, the Young People's Advisory Group that we run at the University of Hertfordshire. And I've tried to take a lot of the learning from the work that I've just mentioned. So we involved children and young people. So the group had kind of basically fizzled out over COVID. But we had a couple of young people who were still engaged, who'd been involved in the last iteration of the group. And so I had some discussions with them about what worked well, what could be improved, what we wanted to take with us into the relaunched group. And we had another young person who was interested as well. And that young person, they've been involved in helping to develop the plans for the group. And also one of the young people is now a peer mentor. So he's co-facilitating the group with me, and I think that made a huge difference when we started, having a young person who was kind of welcoming people and doing the icebreakers and things like that, and being there alongside me and the other adults who were there, I think really made a difference. And it was interesting, I noticed at lunchtime that some of the group members were coming up to me and going, "What are you? Are you one of us or are you one of them?" And I think it was quite interesting how it kind of changing that dynamic. And again, I think as with the Moorfields group, we're working towards co-production. So we had a session in the first meeting where we were discussing where we wanted to meet, how we wanted to meet, whether we wanted to combine online or in person, what days you wanted to meet on, and we then followed that up with a Google poll to find out what works for them. So we're trying to work around what they want to do and how they want the group to work, and agreeing ground rules and things together. So a few key ideas just to kind of finish up with, kind of just pulling together some of the things I've been talking about. A thing about having flexibility, being sensitive to individual circumstances. So while of course digital exclusion is something to consider, for a lot of young people, particularly those who don't live near the city or town where the young people's group is meeting, or some disabled children and young people, online can actually work better, but though it can exclude others. So in the group that I've just been discussing, we've decided to alternate. So we're meeting 6 times a year, and 3 of those meetings will be online and 3 will be in person. But also, if it's not working, as I mentioned with the drug and alcohol study, if it's not working, then you need to adapt to your model, you need to adapt to your approach, not, as I've seen happen sometimes, just say, oh, it's not working, we need to get some different children involved. And if you can plan in collaboration with the young people you want to involve, or with some of them, because they always come up with things that you won't have thought of and you weren't expecting. And also it's setting the intention to be collaborative from the start. Finding ways to be creative, have fun, do things that involve, the group coming together and, bonding as a group is really important too, that it's not just a forum where they sit around a table and researchers come and present to them, that you actually build in some time for them to do some other things as well. And as I said, involve them throughout the process if they want to. But also think about when you were planning to evaluate or report on or disseminate learning about the group, making sure you involve them in that. I review quite a lot of journal articles on public involvement and consistently give feedback about this is great, but actually I want to hear about from the young people who are involved as well. I don't want to read yet another journal article from researchers talking about what they learned about involving children and young people. That's interesting, but you don't get the full perspective then. And also, I think picking up on things that Peter Beresford's talked about in the past. Also remember that, particularly when you're talking about vulnerable or marginalised young people, the children also have a right not to be involved. And I think that's really important too. With the best will in the world, you might want to involve children and young people, but they might have other things going on, particularly young people who are living in difficult circumstances, or young people might want to start off being involved and then drop out. And you can ask them a couple of times, if they want to be involved, but sometimes you just have to let that go. So I think there is a balance between trying to be inclusive and respecting people's right not to be involved. So just a couple of things to finish up on in terms of questions. Obviously, I think there's lots going on in the chat already, I can see. But thinking about if there are any examples of accessible or inclusive involvement of children and young people in research that you'd like to share, either in the chat or on using the Twitter hashtag, and what your thoughts are on how we can best work with diverse children and young people in ways that work for them, and how best those of us who are interested in this, can share and develop good practice. But also thinking about what are the challenges and barriers that you faced, because I think one of the things that would be really good to do is develop the communities of practice that we are in or could be in order to kind of work together to kind of address some of this. And also how to keep children and young people's involvement on wider public involvement agendas, because it does have a habit of kind of popping up every so often and then disappearing. And so I won't talk through these now, but there's a whole bunch of references and further information that might be of interest. And also, you'll get the slides afterwards with my contact details. But I'm going to stop sharing now and we'll open up for questions and discussion.
Okay. Thanks, Louca-Mai, for a very interesting presentation. Maybe if we'll start with the Q&A actual tab there. I don't know if you have it in front of you or if you want me to read it out. Yep. So the first question there is from Azza. What has been the biggest and most frequently experienced challenge that you experience in youth involvement across different projects?
I think there have been many. I mean, I think the biggest one, I think, is getting funding. I think one of the biggest challenges is getting consistent funding to do involvement well. I think it's quite often something that's kind of funded on, on a shoestring or through money from other projects. So I think that's something that we really need to think about. But I think it's, and particularly if you're talking about young people led research, I think resourcing it, making sure that you've got the time and the money to do it well and bring in the relevant expertise, I think is probably a really important one. I think, as you also asked a question about planning and conducting a participatory workshop to discuss the findings of a systematic review.
Yeah, you had a follow-up question there.
Yep. Did you want to kind of talk about that? Would you be interested to know a bit more about is that something that you're planning to do?
No, I don't know if he's available to talk, but I gave him the option to talk there.
Hi, can you hear me?
Yes, we can hear you.
Okay, great. Yeah, so I'm planning on conducting a participatory workshop with young people. So I'm conducting an umbrella review on involving young people in health research. And one of the main objectives is to identify all the challenges that are experienced by researchers and by young people in participating and contributing to health research projects. So I want to hear from the young people and to hear their reflections and their experiences, and whether the literature actually reflects their experiences. So I'm planning on conducting a participatory workshop, and I was just wondering if you have any feedback or if you have any suggestions on how to go about it.
Yeah, absolutely. And I think I'm aware of time now, but I think hopefully, have a look at the references in the presentation. There's quite a lot of resources and things there which will give you some examples of kind of thinking about things to plan. But so yeah, I would say have a look at some of those resources, and then yeah, but do feel free to drop me an email if you'd like any more information. But I think if you can, what might be good to do is if you can access a young people's research advisory group or another group first, and go and talk to them about what you're planning to do. I think that goes back to what I was saying about actually getting their input into planning it. I think a lot of the Generation R young people's advisory groups, potentially might be able to, give you some advice, because they've all been involved in quite a lot of research.
That's great. Thank you so much. And that was a really good presentation. I really enjoyed it. Thank you.
Thank you.
Okay, I'm just going to go to the next question. We probably won't get through these all, but we have one here from Maureen. Is there an ideal age range for a CYP group? We are a pediatric research network, so our group is 13 to 18 years old, but I've seen many groups in pediatric research that involve up to age 25. Can 13-year-old be in the same group as a 25-year-old?
Yeah, no, that's a really good question. And I think Shauna, the next question from Shauna kind of speaks to this too, in terms of looking at, working with young children. I think so. The last couple of groups, so the one that we have at Hertfordshire and the one at Moorfields were both 8 to 18. And I think in that I think that can work quite well, because you can have the older young people can support the younger ones, and you can also do breakout groups, because obviously there is a world of difference between 8 and 18-year-olds. But I think sometimes people tend to go for 13 and older because they think it's going to be easier. And in my experience, I think 8, 9-year-olds, are often very keen and are perfectly able to be involved. And also, I think in relation to Shauna's question, if they're struggling to understand what you're saying, then it's probably because you're explaining it wrong, rather than because they're not old enough yet. So I think, generally, I think younger than 8 gets tricky. I think it's certainly possible, but you might have to take a different approach. So it might be worth looking into something like the mosaic approach or participatory methods as a way to involve younger children. But I know that in the Hertfordshire group previously, that had been 13 to 21, I think. And actually, a lot of the young people I spoke to said that actually for 13 or 14-year-old, that was really intimidating. If you had, kids who were, in their early 20s and working at university, they were more comfortable with it being 8 to 18 than up to 25. But yeah, absolutely, there are some groups that go up to 25 or older. So I think a lot of it, again, I think it's about involving children and young people in planning that and talking to them about what works, and also thinking about what works for it might also depend on your particular research project or organization and the age group you're working with. So I think it depends, but I think So I think, in relation to your question, Maureen, I think, if you in your case, you're working with 13 to 18-year-olds, but you might want to extend that to slightly older or younger.
Okay, so the next question we have then is from Shauna. Do you have any recommendations for presenting complex ideas to children aged between 5 and 11 at the beginning of a workshop or focus group?
So yeah, I mean, as I think as just said, I think the main thing is kind of developing it and piloting it in collaboration with children, I think is really important. Again, going to established young people's groups or local services and working with them. But I think it's simplifying it. It's a good discipline, it's like plain English, to try and work out how to present complex ideas to children. But I think the best way to find out if you've done it right is by piloting it with children of a similar age. But I think generally there are always ways to do it. You just have to think creatively and involve young people in deciding how best to do that.
Okay, we'll move on to the next one there, but from Shirley. Can you clarify what you meant about not needing ethical approval for involvement? Do you mean that as a researcher or research team, we want to involve CYP in devising our research priorities, we shouldn't have to apply for ethics to do so?
Yeah. So yes, I mean, I think certainly in England, the Health Research Authority are really clear on this, that you don't, it's public involvement. You don't need ethical approval for public involvement, particularly because quite often you want to do public involvement before you apply for ethics. So I mean, I think the really important difference here is going back to what I said, right, this is about involvement, so you're not talking about children and young people as research participants, as sources of data. You're involving them in the research process, and that is a different thing. So as a general rule, the guidance from the National Institute of Health Research here and other organisations has been that that's distinct from participation in research and therefore doesn't require ethical approval. But it varies from organisations. Some universities do want you to go through ethical approval for involvement. So I think the best thing is to speak to the ethical bodies, where you work, in your institution, and get their advice. But do have a look at kind of some of the guidance that's out there. And I'll maybe after this I'll share some of the UK guidance on this from the Health Research Authority on public involvement and ethics.
Okay, because I do want to keep the time, and I know we're coming up towards the end. What I propose is that I'm going to copy the questions that we haven't got to answer yet in the chat and in the Q&A section as well.
Yeah, no, that's fine. I think there's one more in the which is quite an important one in the Q&A about payment. And yes, sorry, yes. I hadn't come to that, but yeah, absolutely. I personally think it's really important that you do pay children and young people for their time in the way that you should pay anybody for public involvement. So it varies. I think with young people's advisory groups, generally I've paid vouchers because it's easier. So, they might have a £20 voucher for coming to a meeting. But if so something like the co-production project I mentioned, where the co-produced evaluation, in that case, we paid young people, we agreed, I think it was £10 an hour. We had an hourly rate where we paid young people for their time, and they logged we agreed with them how many hours they were going to do at each stage of the research, and then they were paid for that. So with co-production or that kind of thing, you might need to kind of pay them differently. But yes, I think some kind of payment or reward is really important in recognition of their time.
Okay, so that's brilliant, Louca-Mai. For the other questions, what I'll do is I'll copy you, and I might send you an email, and hopefully then you can just give a brief answer to them if you have the time to do so. But I'd like to thank you very much for a very interesting presentation, and thanks to the attendees as well for the questions and the feedback. What I'll do then also in the next couple of days, I'll send an evaluation form out just to get your feedback on the presentation, and not so much Louca-Mai's presentation, but the format that we use and how we might improve it as we go along. In the chat, I've put in some links to other presentations coming up in the next 2 to 4 weeks. And also I'll discuss about a shared learning group that we're going to be running to come together again and have further discussion.
That's great. And I think that'll be a really good chance to kind of pick up on some of these things. And I haven't had a chance to look at Twitter yet, but do use that hashtag, if those of you who use Twitter as well, because that'll be another way to kind of continue the discussions after this.
That's it. Thanks a million to everybody for attending, and also a massive thanks to yourself, Louca-Mai.
Thank you. Thank you,
Thanks
everybody.
very much, everyone. Bye-bye. Bye-bye.
Bye-bye.